Hi everyone, I'm Dr. Motahare and let me ask you some personal question. Have you ever been told you have an ovarian cyst and instantly you felt scared? You're not alone. Everyday women around the world hear these words and wonder, is it dangerous? Will it affect my fertility? Do I need surgery? The truth is most ovarian cysts are harmless, but some deserve your attention. In the next few minutes, I'll show you exactly how to tell the difference, simply, clearly, and without medical jargon. So, take a deep breath and let's make sense of ovarian cysts together. What are ovarian cysts? Ovarian cysts are fluid-filled sacs that form on or inside an ovary. They are very common, especially in women in reproductive age. In fact, around 7% of women will have ovarian cysts at some point in their lives. Most are benign, non-cancerous, no malignant, and many of them just go away on their own. But understanding the type of cyst helps us decide if it needs more attention or not. We divide ovarian cysts into two main categories: functional and pathological. Functional cysts are part of your normal menstrual cycles. These include follicular cysts and corpus luteum cysts. They often disappear by their own in few weeks. Pathological cysts like endometriomas, dermoid cysts, adenomas, and some others developed from abnormal tissue growth. These are the ones that we should monitor and also sometimes decide to surgically remove or do some treatment for them. Many ovarian cysts don't have any symptoms at all. They're discovered by chance during a pelvic ultrasound. But when symptoms do appear, they can include pelvic pain, a sense of fullness or pressure in the pelvic, sense of bloating, irregular periods or pain during sex or urination. The symptoms can be so vague. That's important because if you feel some kind of vague um, discomfort in your pelvic area, you should see your doctor and ask for help because sometimes symptoms are not that much clear. When a woman presents with pelvic pain or a mass, there are other possibilities besides ovarian cysts too. Like what? Like ectopic pregnancy in sexually active women in reproductive age, or ovarian torsion, or ovarian abscess, endometriosis, and so on. Each of these categories has their own other symptoms too. Means that if it's ectopic pregnancy, we have other symptoms too. Or ovarian torsion, the pain is different, but it means that there are other differential diagnoses too. Not all pelvic pain or fullness is because of ovarian cysts. The first and most important step for diagnosis of pelvic pathologies is an ultrasound, especially a vaginal ultrasound. If there's any cysts in the ovaries, it can easily tell us about the size, structure, or even it looks simple or complex. And if based on the information that we get from this ultrasound, we will add other tests too. If we are suspecting ectopic pregnancy, we will ask for a beta-hydroxysteroid pregnancy test. If we think it's a kind of ovarian torsion, we will ask for Doppler sonography of the ovary. If we want to know more details about the structure of that mass, we will ask MRI. And sometimes, based on the ultrasound, we will understand that this is a functional cyst. And we don't need to do anything else, just observe in a few months. In a few months, repeat the ultrasound again. to see whether it's growing or decreasing in size, what happened to that. So with a simple ultrasound, we start our investigations, and based on the result, we will go further. Now, this part is really important. See your doctor urgently if you experience sudden severe abdominal pain. This could be an ovarian torsion or a ruptured cyst or a ruptured ectopic pregnancy. Sudden severe pain always is important. Okay. If your cyst persists for months, as you do some tests, ultrasound now, and after 3 months, you just go to doctor again, do an ultrasound, and it's get bigger. You need to do something for that. Or it's more than 5 centimeters in size. In ultrasound, there is some solid areas or complex images. All of these things can appear in an ultrasound, and your doctor will decide what to do. It's also important to notice that after menopause, if you found an ovarian cyst, it's very important to do a complete workup, because the risk of malignancy increased after menopause. So if there is any cyst after menopause that not completely satisfying, that is a benign one, simple one, we should do a complete workup. Treatment depends on the cyst type, size, and symptoms. Many functional cysts disappear on their own, so doctors often recommend watchful waiting. That means repeating the ultrasound after a few weeks. Some others also may use some birth control pills in order to prevent new cysts, but this is just for functional cysts. The other types of cysts treatment are completely different. If they are large or painful, persistent, suspicious for cancer, anything different. If we are thinking about endometrioma, treatment is surgery. If we are thinking about some cancer, we should remove the ovary and also do the pathology and find out what is the type, and also do the other complementary tests. That means that all are depend on the size, type, and also symptoms of the patients, the method that we use for treatment. The good news is that most cysts are completely treatable and outcomes are excellent. The overall outlook of ovarian cysts is very positive. Functional cysts usually resolve within 2 or 3 menstrual cycles. With regular monitoring and timely management, complications like torsion or cyst rupture can be prevented. Even when surgery is needed, recovery is usually very fast and fertility is preserved in most cases. The key is awareness. Listen to your body and never ignore persistent pelvic symptoms. Thank you for watching. I hope this video helped you understand ovarian cyst a little better. If you found this video helpful, don't forget to like, share, and subscribe to the Art of Medicine. I'm Dr. Motahare. Stay healthy, stay informed, and see you in the next video.